It is October. That means it's Breast Cancer Awareness Month. And while most of the attention focuses on women, rightfully so, it's important to remember that breast cancer can also affect men. Though rare, it can be just as serious, but it often goes undiagnosed or even ignored. So today we are joined by Dr. Erica Rager with Franciscan Health, who's here to help us understand more about breast cancer in men, what to look for, who's at risk, and why awareness really matters. Thank you so much for being here.
Well, thanks for having us.
So let's start off with just how common is, or how rare is breast cancer in men?
Yeah, it is. It's not very common. Breast cancer in men represents about 1% of total breast cancers, so a little less than 3,000 a year. Gentlemen will be diagnosed with breast cancer. So it is a little bit unusual, but it's something that can happen, and so it's the kind of thing that we want men to be aware of.
What causes breast cancer in men? Is it the same thing as women?
Yeah, so for the most part, we actually don't really know what causes breast cancer. For most people, the two biggest risk factors are being female and getting older. So for men, it's getting older. Although in particular for men, anytime a man's diagnosed with breast cancer, we do worry that perhaps they could carry a gene that runs in the family. So in general, most breast cancers are, we don't know what causes them, but for about 10%, they're caused by a gene that runs in the family. And that number is higher it's higher in men. And so anytime we see a man who's diagnosed with breast cancer, or there's a man who knows that there's a gene associated with cancer that runs in their family, that's also something that's important to keep in mind.
I think you really hit on something important, which is knowing your family history.
Yeah.
I'm kind of surprised that actually when I was growing up, we didn't really talk about family health history, but I've since learned how important that has become.
Yeah, and traditionally, especially cancer was something that people just didn't talk about a lot. But over the years, it's been a lot less stigmatized, and people are more likely to talk about it. And that's really fortunate because we've learned a lot more about those genes that do run in families and their associations with different kinds of cancers. And so in particular with men, there's a gene called BRCA2, and that gene is also associated with an increased risk of prostate cancer and melanoma and pancreatic cancer. And so, if there are a lot of men in your family who have prostate cancer or close relatives with pancreatic cancer, along with breast, that starts to make us worry that maybe you do carry one of those genes in your family.
And if that is the case, do you get screened? Should you talk to your doctor about it?
Yeah, so you should definitely talk to your doctor about it. There are genetic counseling programs where you can meet with a genetic counselor who can really help you go over your family history and all the potential implications of testing, and then do that testing for you. It's still pretty uncommon to recommend regular screening for men. Even men who are at the highest risk of developing breast cancer are actually less likely to get it than your average woman.
Okay.
So it's still, sometimes if you have a big family history, or if you're particularly worried about it, we will recommend regular physical exams and mammograms for men, but that's pretty unusual.
Let's talk about symptoms. What should men be looking for?
So the thing that we most always find in a gentleman who's diagnosed with breast cancer is that he has a mass. And that mass or lump is almost always right behind the nipple. So right behind the nipple and areola, you'll often see some thickening, feel a lump, notice the nipple pulling in or maybe even draining blood. So those are all things that definitely get our attention and need some further evaluation. That said, there are lots of things that can cause lumps in men that are not cancer. So just because you find a lump doesn't mean that you have to be scared that you do have cancer. It just means that it needs some additional evaluation.
If it is found to be cancer, let's talk about treatment. What does treatment look like?
So in general, actually, breast cancers in men and women are really treated the same way. But one thing that we find is, we tend to talk about breast cancer like it's all one disease. And really, it's a spectrum of diseases. And so the treatment is really individualized based on the characteristics of the patient and the characteristics of the tumor itself. So almost everyone who has breast cancer will need surgery, and almost everyone who has breast cancer will need some kind of medicine. Sometimes those medicines are hormone blocking pills, sometimes it's IV chemotherapy, sometimes it's immunotherapy, sometimes it's a different kind of targeted medication. Sometimes it's a combination of all of those things. And so the most important thing is to make sure that you get your care as part of a multidisciplinary team where all the doctors are working together to guide that treatment and make sure that you get the right treatment for you, not too much and not too little.
Let's talk about misconceptions. Any misconceptions or myths that have to do with breast cancer in men?
Well, I think in particular, one thing I see is if a guy comes to see me in the office and I want to send him for a mammogram, he's a little bit uncomfortable with that, right? So, a mammogram is really just an x-ray of your breast tissue. It's not the most fun you'll ever have, but it's not terribly uncomfortable and it's quick. And even though most guys never have a mammogram, the folks in the breast center are accustomed to seeing men, and so they'll get you a blue gown. You don't have to wear pink. And
oh, good.
Yeah.
What's your final message that you'd like to get across to men specifically as it relates to breast cancer?
So I think the most important thing really is to know your body. Know when there's a change in your body, know when the person sitting next to you tells you there's a change in your body that requires some evaluation, and then come in and see your doctor. Get the mammogram, potentially get the ultrasound. Don't be uncomfortable or embarrassed or worried that just because you find a lump, it means you do have cancer. Just come on in and we'll take care of you one way or the other.
All right, great. Dr. Erica Rager with Franciscan Health, thank you so much for being here.
Yeah, thank you.